My name is Al Ali. I'm a professor of plastic surgery at UT Southwestern in Dallas. So let's talk about massive weight loss body contouring. This happens to be an area of expertise for me. We have a significant problem with obesity in the US. If you looked at people who are overweight, it's something around 70% of Americans. Somewhere around 35 to 40% are obese. And that means that people are at a level where it actually affects their longevity and health. Fortunately, there are a number of procedures out there, surgical procedures which help people lose weight, bariatric surgery, and lately there's a significant number of new drugs that are now becoming safe, and with good care through a physician, people are losing weight. From the standpoint of plastic surgery, we don't operate on people when they're heavy. We operate on people once they've lost the weight, hence the term massive weight loss body contouring. I divide the body up into three parts. The most common area is the belly, sides, and back, which includes the buttocks. So when you get inflation of being obese and then deflation, the following things can happen. You can have hanging tissue in the front, which is called the panniculus. The pubic area is lower than it should be. The front of the thighs fall, the outer thighs fall, and the buttocks falls. All those things come in together, and we use one operation to fix that. That's called a belt lipectomy, or it's a circumferential procedure that goes all the way around with a scar that kind of runs where a French bikini thong would run. That's the final scar. So what does it do for us? It flattens out the abdomen, pulls up the pubic area in a more appropriate position, lifts the front of the thighs, the outer thighs, and very importantly, lifts the buttocks back in its proper position. The second area you kind of think of as the upper trunk, which starts at the base of the breasts or the chest and goes up to the neck, and it's all the way around again. And that usually is in combination with arm excess. Most patients come in complaining about arm excess as the number one thing because they have a lot of hanging tissue in their arm, and many of them will call it bat wings or whatever, very funny names for it. But it's very quite bothersome for patients because sometimes even after you fix the chest and the upper back and all that, their arms still will not fit in regular clothing that they fit in elsewhere. Specifically for the arms, we have arm reduction surgery, which is called brachioplasty. And in essence, it's removal of all this excess tissue from the elbow up to the armpit, and it goes onto the chest wall a little bit. If you combine that now with whatever effect the weight loss has had on the breast or the chest, we usually do something to fix the breast or the chest. In the female, it's obviously the breast. That would vary anything from a breast reduction, if they're still very large, to maybe a lift with implants, because the tissue's been very deflated and reduced. If it's a very small breast, we'll augment the breast. In the male, we would reduce the excess breast. Sometimes it's the size of a female breast. Obviously, you create something that looks completely different than what you create in a female. You want to create an attractive chest in a male which has some parameters to it, and we obviously aim for that rather than creating something that's feminine. Many patients have rolls in the back that can be as high as the breast area or the chest area. Sometimes they go to the middle of the back. And part of the surgery in that area is eliminating all those rolls. Again, if you think of the body as a mannequin, which is the muscles and bones, and then the outside is either a dress or a suit, and you're trying to make that dress or suit fit that underlying mannequin so there's not wrinkles in it, either in the upper or lower, which is the lower part that we talked about. Lastly, the area that also tends to bother people are their thighs, and sometimes these thighs can be very large. When they reach their final weight, they still may be large, and then you have to address them very differently than some people where the thighs have reduced easily, and then you could do some more operations for them. Lastly, some people end up, because of their original fat deposition pattern, meaning the way the fat was deposited, and that's genetic, we can't control fat deposition pattern. Some people have very large necks, especially fat underneath their chin. They will end up with a lot of hanging tissue, and you can eliminate that with a face neck lift, but there are some special adaptations that you must do for massive weight loss patients, again, to create a sharper face, meaning from the neck down to the chin, a sharp edge rather than just a bulge, and creating a more appropriate, thinner appearance.